Hello, good afternoon. It's Reggie, the dentist again. Speaking to you about the relevance of diet in dentistry. It's one of the most underestimated thing in relation to what we eat and how it affects our teeth and how it affects our gums and our soft tissues in the mouth and in relation to the tongue and digestion and in terms of demineralization of the teeth and enamel. Let's talk about the first thing about things which are not discussed. We don't often discuss about the relationships or combination of foods. Give you an example. Right? If we have too much of foods which are containing too much of acid, so if you have oranges and pineapple, it tend to cause an acidic reaction, right? So technically, you should have only one kind of fruit or one color of fruit because the pH remains the same. So obviously, is that we need to understand that diet affects the so-called pH, and the pH affects the so-called acid reaction. Acid reaction affects your total health status. So if you're alkaline, you are in a healthy state. If you're in an acidic state, you're technically in a disease state. So what should we do? We should always make sure that whatever we eat, whenever we eat, make sure that a combination of food that doesn't cause acid reaction. So I use fruits as an example, and then let's talk about salads. Right? When we should eat salads and when we should eat our fruits, we should try to have this before 12 o'clock midday. That's when the rising sun is there. Say that basically that the foods are energized with the rising sun, right? So we should have foods before the main meal. What does it affect it does in terms of digestion affecting you as a dental patient? Well, the first thing is that these raw foods affect your pepsin. The pepsin is released in your gastrointestinal tract, what you know as part of your stomach, that causes digestion. So it prepares the digestive juices to be released so that correct breakdown of digestive enzymes affects the teeth positively. If we have raw fruits and raw vegetables like salads after meals, it tends to take a longer time to digest, often causes indigestion. Right? So there is the black seeded fruits, often known as the most pH balanced fruits, like blackberries, blueberries are very good. Pawpaws are very good. Kiwi is very good, right? So we should tend to have foods which have a lot of energy, and one of the foods of energy is watermelon, right? In season time, watermelon has got what we know as is energizing fruit because it's got a lot of water, right? And the water's got what we know is got tonic energy, and that tend to sort of creates an impact in terms of your, as an antioxidant, affects your fluid levels in terms of the digestive effects in all your digestive tracts, right? In terms of all of your lymph drainage, your lymph vessels, and which is important to realize that we need water. One of the most common things that we often tend to ignore is drinking water and a slice of lemon. So lemon is not acidic, lemon is more alkaline. So if you get in the habit of drinking lemon water all day, you often stay in an alkaline state, especially in hot countries, you need to be dehydrated. And people said, oh, I want to have a cold drink, when I have a juice. But you tend to have everything that's fresh, nothing that's packaged, and nothing that's in a bottle as such. Let's talk about a few of the cooked foods, right? There's a big move in terms of veganism and whether we should have milk or non-milk dairy or non-dairy foods. So this is often debatable, right? There is some pros and cons to it. Everybody has an individual trajectory in terms of the way they feel about it, but definitely everything needs to be in a balance, whatever that you may have, right? Everything in the correct proportion is done correctly, whether it's almond milk, whether it's oat milk, whether it's rice milk, right? The correct dairy milk that doesn't have any additive, that's farm fresh, used proportionately, that use it as a milk substrate, or in terms of making cheese or making what we know as in terms of yogurts and buttermilk, right? So it has its purpose in terms of its efficacy on the gastrointestinal tract, right? So we talk about a little now on cooked foods. One of the common things that we often make a mistake, we often have things like beans and potatoes, with protein and carbohydrates. So we should try to have foods which are more balance in terms of the pH. So if you have proteins and carbohydrates, you find that carbohydrate negates the protein effectiveness of the absorption effect. So if you're having carbs, you should have carb by itself, protein by itself. There's a thing, a big move in the world, talk about banting diet, low carb diet. There's some rationale to it, definitely, right? What are some of the background to having a low carb diet? Right, low carbohydrate diet, like the 5 principal things we know is, like, example, white maize meal, breads, pastas, pizzas, potatoes, and these kinds of things, what they call, are high carbohydrate foods. Carbohydrate breaks into sugars. Sugar causes an acidic reaction. Acid reaction affects your pH. Your pH affects your functioning in relation to your heart rate. That doesn't affect your lung compliance. So it's a whole conglomeration of factors. So we need to have it in a totally, balanced state, whatever that we have, and how did we eat ourselves. Naturally, that we shouldn't overeat, and we should eat proportionately in terms of whether it's fats, whether it's the correct fats, obviously, and whether it's protein, whether it's carbohydrates, make sure everything is in proportion. There are things on superfoods that we will talk about and in subsequent videos. So just to highlight about what does acidic foods or breakdown of sugars from carbohydrates or sugars per se itself. It causes a thing called demineralization. You might have recently that GlaxoSmithKline released a toothpaste called Pro Enamel, which sort of remineralizes the enamel, right? But you can research it in terms of, I'm not promoting pro enamel at all. I'm just promoting on an alkaline state of, from perspective of how you should maintain your body state, right? So I think that this is all for now, and I'll be back with you in a short while. And enjoy the day. Remember, alkaline, healthy state. Acidic is technically in a disease state. Stay healthy and low carb diet. Thank you.